It is not okay that you are needing to change your pad every 1 to 2 hours. Hi guys, welcome back to my YouTube channel. My name is Melody and I'm a registered nurse. In this video, I'm going to tell you how you know your period is very heavy. A very heavy period is not normal. It means that you are losing too much blood than you are supposed to do. Typically, our period will last between 3 to 7 days. And within those 3 to 7 days, you're not expected to lose more than 90 ml of blood. So let's say your period is 4 days. You're expected to lose between 30 to 90 ml of blood within those 4 days period. 90 ml of blood is about 6 tablespoons of blood. So you're not supposed to lose that in those total number of days you are menstruating for. However, it can be difficult to measure these 30 to 90 ml of blood, except for some few people that actually use menstrual cup where you can physically see how much blood is coming out. But for people who use tampons, pads, or other products, it is very difficult to measure it, except you're going to be weighing that pad every time you take it off. So I'm going to tell you some factors or 10 things that you should look out for that should suggest to you that your period is probably very heavy. One of them is how often you are changing your pad. So you shouldn't need to change your pad every 1 to 2 hours. And if you don't do that, you get soaked. No, that is not supposed to be. It is not normal. Now, this can be the case for you. Maybe since you started menstruating, this has been what you've been going through. For some people, they've had a different experience, but suddenly you notice that you are now needing to change your pad every 1 to 2 hours. Then that is absolutely a big red flag that you should check out. Another thing that should suggest to you that your period is too heavy is your period is more than 7 days. Ideally, your period should be within 3 to 7 days. But if in your own case now your period is now lasting more than 7 days, it means you are losing too much blood and it is not normal. Another pointer to a heavy period is you needing a double protection. So if you are now having to wear both tampons and pads for you not to be soaking through, that is not normal. Now, it is understandable that some people like that double protection. They don't want to give any chances at all. But if you are doing that, because if you don't do it, you're automatically getting soaked, then that is not normal. Some people also use double protection because they are not very familiar with tampons, for example, and they want to use a pad as a support. That is different from people who are doing it because if they don't do it, they get soaked. So if that is your case, it is not normal at all. Another thing that should tell you that your period is very heavy is if you have large clots during your menstruation. During your menses, it is normal to have very small clots that come out, but if they are very large, it means that your period is very heavy. I'm going to try and attach an image to show you the difference between those small clots that you are expecting to see with your menses and the abnormal large clot that is not expected. Another thing that should tell you that your period is heavy is if it is affecting your daily life. So if during your menses you feel very tired, you feel very exhausted, dizzy, it means that you're losing too much blood and your red blood cells is become so low that it is not carrying enough oxygen to the tissues. And those are the signs that you will see with low red blood cells. So if you are feeling like that during your menses, please, it is not normal. So I'm going to conclude this video by reminding us as women that our bodies are different. How we menstruate, when we menstruate, how many days we menstruate is going to be different. But these are like common pointers that should tell you that something is very wrong and you should have it checked out. And as women, one of the things that actually suggests that something is wrong somewhere in our reproductive system is usually the period. Obviously, you're not going to be scanning yourself every now and then to know what is happening inside. But for most problems that women would have, we have fibroid, PCOS, cancers, infertility. Most problems that are concerned with women is usually suggest that it is the period that would always tell you that something is wrong. Either you are not having your period, either your period becomes irregular, your menstrual flow becomes lighter, becomes heavier. All of these things are suggestions that something has changed. Now, small changes are very okay in our body. For example, let's say your menstrual cycle used to be 30 days and it changes to 26 days, or your period used to be lighter and then it becomes a bit heavier than it used to be. These are hormonal changes and sometimes it doesn't suggest any problem. But if these changes are rapid and if it is affecting you, or if your period has become very heavy, those are things that you should actually go and see a doctor for. Now, for people who have started menstruating, let's just say the first year of your menses, you are going to see so many changes. Your cycle will change, your flow will change because your body is trying to get into a rhythm. So those are very much normal for people who have started menstruating. And for others, it is also normal for you to see different changes. And these changes can be affected by the kind of food you are eating, stress, weight loss, weight gain. All of this can cause changes in our menses, but it shouldn't be such that it is affecting you. And there's nothing wrong with actually checking things out. If you don't understand what is happening, have it checked out. It could be nothing, it could be something. Anyways, thank you guys for watching. If you think this video was nice, it was helpful for you, please make sure you subscribe to my channel and also share this video. Thank you guys. Bye bye.